So this tumor board goes the next step. It goes to a higher level, or a high level of service that we can provide by being able to bring in other physicians into a particular patient's case, and to get different input and opinions, and for us as a team to come up with the latest and best treatment by looking at all of the different information that we receive from each patient. Each patient has a lot of data, and if we can present all of that data to a team of experts, which includes radiologists, radiation oncologists, pathologists, and specific oncologists, or multiple oncologists who can all give an input into each patient's case, it really helps us to mastermind, or have a broader scope of thinking around each patient's presentation, and therefore come up with a very nice, or basically the latest and best treatment option that we think would be the best for that patient, including some diagnostic testing. For example, some of the latest molecular tests that we can do to help us decide what's best for the patient, or how best to interpret those molecular testing on the patient's either tumor or even on their blood. So by bringing in different expertise for the molecular side, treatment side, clinical trials, imaging, radiation, pathology, all of that put together, all focused on one patient in one room, would be really of major benefit for each patient, and would save the patient a lot of effort, time, and and travel time, in terms of them not having to go to the center or the major academic center and see all the different doctors, and then come up with a treatment plan after a week or so of meeting different people in a different country. So here we get the data, we interpret the data and come up with a best approach. Now, it's always better for us to see the patient, examine the patient, talk to the patient and family. But if they cannot travel, I think this is the next best thing. Or if they don't want to travel, or if they feel they can afford to travel, then this would be a great next option for them.